Hi, my name is Dr. Jessica, and I'm here with Linna, and she is a doula out of the Twin Cities. And so, Linna, would you be ever so willing to introduce yourself, and how did you become into a doula?
Thank you. Thanks so much for having me on. I really appreciate it. So my name is Linna Wilkins. I just formed Womb to World MN LLC, which is our doula agency, and where their goal is to provide service to any birthing person that needs uh, support preterm, during labor, postpartum, lactation, and beyond as well. And so I got into being a doula because I was a labor and delivery nurse for a long time at one of the Twin Cities' most critical or high risk units, I should say. And I love the job that I did, but more and more I found myself not able to give the full spectrum of care that I wanted to my clients and my patients at the time because there's so many demands on the healthcare facilities and so many demands on nurses and physicians. And many times I would be able to come in, do a set of vitals, check on mom and baby, and then I'd have to walk out because I had other patients and I had charting to do and other responsibilities. So especially first time moms and it doesn't matter, what baby number this was, but they were left to labor on their own with a partner that may or may not know what they're doing. And essentially they're vulnerable adults at the time. And so when I had an opportunity to come back and say, what do I really want to do with my life? Where does my passion lie? It really came around helping parents bring these new little souls into the world and do it with the best of capabilities. And when I read some of the recent studies, and if I don't mind, I'm just going to state
Yeah.
some stats real quick, because I think this will be
Yeah.
important for people to know. I'm actually trained through Dona International. Um, and DONA cites a research study that had over 15,000 people who participated in 21 randomized control trials. And they found that those that had primacy of care, meaning they had one person that was there solely for their service. So they're not related to the client, they're not related to the healthcare system, they're not related to the medical industry in any way. This is somebody that is hired to be there as an objective, emotional, social support, and that can help parents through labor. Um, they had 28% less likely, were 28% less likely to have a cesarean, 31% less likely to use synthetic oxytocin to speed up labor, 9% less likely to use pain medication. And I just want to clarify that anyone who hires a doula does not mean that they're on the far end of the spectrum where it's completely natural and nothing else. It's whatever you choose to have for your delivery, whatever is comfortable for you is what a doula can support you with. So 9% less use of pain medication, and 34% less likely to have less likely to experience childbirth negatively, right? We all know how important that is to have a good birth story, how much stress levels are decreased for mom, for baby, for the family, and there's better outcomes and better beginnings. In addition to that, um, people in the BIPOC community are among the highest risks. And so when you have somebody there to advocate and to look at the social injustices that may be happening and to be there to help inform and educate, then there's better outcomes overall. So long answer to a short
Yeah,
story
I
of why
love
I
it.
got into this work. But those are the many reasons. I feel like this is a calling, and I'm really happy to be here.
Oh, I love that. So do you work in the home? Do you work in the hospital, birth center, all of the above, whatever that mama chooses, or whatever you
Absolutely.
choose? Yeah.
It's whatever the family chooses to do.
Okay.
I had my first home birth recently, as a matter of fact. It was a beautiful, beautiful experience. I work in hospitals. I have also had birth center births. So it's wherever you're comfortable with, whatever you choose, and wherever you and your clinician decide is best based on your health records
Okay. Is
and
there
health needs.
is there a radius on how far you're gonna drive and stuff like that, or do you set a limit on like
Yeah.
mileage type of thing?
So I think it's more a matter of how fast can I get to you in rush hour traffic, right? And so for me, it's about 45 minutes to an hour is the
Mhm.
maximum limit because I'd like to be there. So there's a process of making sure that you're actually in labor because sometimes labor can start and it feels
Mhm.
like it's intense. And if it's early labor, then it just wears off, can wear off. And you don't want a doula there too early, right? Because you want them to be fresh and available for you as well. So if a family calls and says, "Hey, I need you here now," I want to be there within the hour
Mhm.
and a half at the very most. And so that's really what determines it. So sometimes it's, if I live in Bloomington, so I serve primarily the southern metro, but um, and sometimes it's harder to get up to the northern areas of the city or when you get a little bit farther out. However, I am a part of the Childbirth Collective, and it's a group of birth workers of all kinds, with doulas, midwives, chiropractors, massage therapists, and others. And so if I can't be the one to help serve you and my team can't, then I'll definitely help you find somebody that fits your geographic and personality needs.
Oh,
So
I
that's
love
another factor as well. Yeah.
that's amazing. What does working with a doula look like from like start to finish type of thing?
Yeah, it's a really good question. So, I think it really depends on what the families need,
Mhm.
right? And so, um, first and foremost, I think when you're looking for a doula, it's important to start early. Although there is a large number of doulas in the Twin Cities, they get booked up really quickly. And so it's important that if you decide that you want a doula to start having your list of questions available, and I can send you a list of questions. Maybe we can post on this site as
Yeah,
well
absolutely.
to ask. And so, first and foremost, is finding someone that matches your values, matches your personality, matches, can give you the kind of support that you need. And so, some people are very natural, and they just want somebody who matches that vibe, who's holistic and uses um, all the natural remedies, and others are completely medical, right? They want whatever their OB says, that's what I want to do. I'm in the middle of that spectrum, right? I have a medical background, but I also feel like our bodies know what to do, and physiological birth is an amazing thing, and every person is capable of it. It depends on what our birthing people want to happen, right? And what they want their experience to be like. So start early, find the doula that you match with. And then from that process, it's going to be a matter of maybe 2 to 3 visits to understand what your desires might be in labor, to do some education. There may be prenatal visits with your clinician, so it really all depends on the doula and you and what your comfort levels are. And then from there, starting at about 36 to 37 weeks, most doulas are on call for you, I should say.
Yeah.
And so at that point, any questions that you have, or they're available for you. So when they're on call, meaning that when you call, that's, they're
Yeah.
they're going to answer the phone for you. So it's a matter of asking questions to see where you are in labor, to be on the phone with you, to make sure that you have everything that you need and your support system is complete the way you want it to be. And then once you start getting into more active labor and you feel like, okay, I need support now, I can't handle this on my own, that's usually when your doula will either meet you at your birthplace, wherever that might be, home, clinic, or the hospital, and uh, start the process of changing positions, making sure that you're comfortable, making sure that you're well fed, making sure that you're well hydrated, bladder is empty, all this good stuff. And then afterwards, after the delivery, um, there's usually, depending on the doula, 1 to 3 visits to make sure that if you're choosing to breastfeed, that you're breastfeeding comfortably, that you have all your needs met, that if you choose to have your placenta encapsulated, that's a thing as well. There are several doulas that do placenta encapsulation. We can connect you with the right people to do that as well. And it goes on from there. But the primary role of a doula is being an educational resource, providing you with resources, providing you with information, and helping you form the questions that help you to be your best advocate. I just want to be clear that a doula is not a medical professional. right? So we don't do cervical checks or heart tones or vital exams or things like that. This is not medical at all. And we also don't speak for you to your healthcare providers also, but we empower you. We might ask questions during labor, like, well, so it looks like doctor's about to start with an episiotomy. Is that part of your birth plan? Is
Mhm.
that what you want to do at this moment so that you and your birth partner can have the opportunity to advocate for yourselves at that point?
Yeah.
And so sometimes it's really difficult when you're laboring and for your partner to who's seeing you go through this much pain or this, this the adrenaline is going everywhere and you may not be aware of what's happening in your surroundings. So having somebody there to say, this is what's coming next. Are you
Mhm.
prepared for this? Is this what you want? So that you
Right.
can make an informed choice at that time.
Oh, I love that. That's
Yeah.
amazing. How does working with a partner, what does that look like on your end? How do you work with the birth provider or oh my gosh, how
Yeah,
do you
birth
work
partner.
with partners in the settings? Yeah.
Yeah, absolutely. So partners and doulas are like the dynamic duo when it
Mhm.
comes to supporting the birthing person, right? And so I think sometimes people think, well, you've got a doula. You don't need the partner to just need much or doesn't they don't need to be as actively involved. And that couldn't be farther from the truth, right? And sometimes also doulas may not include the partner in the conversation because it's all about the birthing person, right? And that connection that you have with each other. But that couldn't be farther from the truth, right? We need both partner, doula, and the birthing person to be in good communication, to understand what the plans are, and to know how to best um, serve our clients and the birthing person. And so it's very, very important for me to have the birthing person's questions answered, make sure they're comfortable with me, make sure that they're educated as much as possible. There's all kinds of resources available online that we can refer them to so that they are as involved in the birth of this baby as the birthing person is.
Oh, that's amazing. And I think you mentioned to me one time that if your partner gets a little bit tired, that you can like tag team each other to
Yeah,
kind of take over certain
yeah,
things if you need
yeah.
counter pressure and stuff like that as well.
Absolutely. I was just in a birth and it was a beautiful situation where mom wanted to be in the tub and I couldn't get in the tub with her to do some counter pressure. So dad put some swim shorts on and got in the tub with them. And it was just, the twinkle lights were on, there was soft music,
I
you
love that.
in the background. And actually, I don't remember if there was music now or not, but with the mood was set.
Yeah.
Right? And it was just a very warm, comforting feeling. And when that happens, when the partner and the birthing person are connected that way, your body naturally produces more oxytocin, which helps to stimulate labor more, which helps to, provide the safe environment around. And so when there is that good bond between the two, life
Mhm.
is so much better for everyone, and it helps the birthing process in general. So that's what I try to promote.
Oh, I love that.
Yeah.
And last question, what is the doula's role after baby is born? So this can be right after baby is born. This can be, you mentioned lactation as well, making sure baby is breastfeeding okay, and then a couple days after as well.
Yeah, so right after the baby is born. So first of all, during the birth,
Mhm.
if it's okay with you and the doula can be a great person to take pictures and videos and whatever during the labor as well, right? So it's a matter of supporting, but if the opportunity presents itself, I think it's a great opportunity to have a photo record of, and so it's usually either with your phone or with a doula's phone, but always confidentiality is maintained,
Mhm.
right? And so what I like to do when I take pictures is send them directly. I'll airdrop them right away or bring them back to a postpartum meeting and provide them to the family. But then I always make sure that I select and make sure that they see that I've deleted it. So I
Mhm.
think sometimes people are like, that's personal pictures that are out there, and it's not,
Yeah.
right? So you do what you need to be comfortable with that. So taking pictures, and then right after delivery, if it's in your birth plan and you'd like, we advocate to make sure that mom and baby are chest to chest right away and try to let the all the blood drain from the cord naturally versus having it cut right away. right? Because there's a lot of blood in that cord that still remains that can be transferred to baby, and should be transferred to baby. So we try to advocate for that happening naturally as much as possible. In the meantime, mom and baby are chest to chest. Before we leave, make sure that baby is latching on correctly, that the family is comfortable, that everybody has something to eat. If they're at home, I usually stay for about 2 to 4 hours, depending on what it is afterwards. Like once the midwives leaves, I'll probably leave as well, just to give the family some time. But really making sure that everybody's comfortable. And the hospital may be a little bit sooner than that, and all depends on the doula. But it's usually afterwards, the doula will stay with between 2 to 4 hours afterwards to make sure that everything is fine before we go.
Okay.
And then we'll check in with you 2 to 3 days afterwards, or maybe a week afterwards. Some doulas also provide postpartum support, so that if anybody needs some help, just somebody to hold the baby while you go take a shower,
Mhm.
or somebody to just make you a meal at home and let you take a nap,
Yeah.
things like that. And there's also night doulas as well that can help you with the transitions between going back to work, or that time where baby's feeding a lot, to be there to watch the baby, to, if you're bottle feeding, to bottle feed, or if you're breastfeeding, to wake you up, give you the baby to feed, and then take the baby and do whatever needed so that you can get some rest. That's available as well. I do want to add also that doulas are also available and should be allowed to be in the OR with you. So if it's a planned C-section, or an unplanned C-section as well, doulas can be in the OR with you to help, tell you what's happening, make sure that your birth plan is followed for your baby, to support the partner, to support you, to take pictures. And most hospitals will allow doulas in the OR. And I think and some may not, some may be more hesitant depending on what the familiarity of the hospital staff is. But it's good to advocate for yourself that if that happens, you have the right to have your doula in the OR as well.
Oh, that's amazing.
Yeah.
Oh, all good things.
Yeah.
All right. Well, thank you so much for being here today with us and answering all of my questions. You've given a lot of insight onto how a person finds a doula, what they're looking for, and how a doula can help with the birthing process. So thank you.
Yeah, thank you so much for having me on. I really appreciate it. And like I said, it's really important to find that right doula, right? Because that's, like I said, there's a spectrum of naturalist to technical, right? And finding somebody within that realm, and then finding somebody on top of that that matches your personality, right? Maybe you're a type A person that needs a checklist and prefers somebody to do that. Maybe you're a little more laid back and want, to know the big picture, but go with the flow. Maybe you want somebody with a good sense of humor that you
Right.
align with, right? So there
Absolutely.
are all kinds of great doulas. I think I'm really happy to talk to anyone that may be interested in having a doula. And I'll send you a link to my website coming up soon. In the meantime, I'll send you my phone number that we can connect to. And if
Okay.
I can't find the right doula for you, um, the Childbirth Collective is a great resource. You can go on their website, or I can connect you with people as well.
Okay, amazing. Well, thank you
Yeah,
so much
thank you.
and have a wonderful day.
Thank you. You too.